The shutdown is because Republicans don't want some of these hospitals to be taking money to pay for illegal immigration and their health care. Everybody says, no, they don't get health care. They don't get health care. Miss, you live in Maine. I grew up in New York City, grandson of an immigrant. You get all these people walking around getting health care from hospitals, but my mother was married to a vet that served this country, doesn't get anything from the government, only the money that she put in for Medicare, which doesn't pay nothing.
Lots of important questions there. Thank you for calling in. I also am a granddaughter of an immigrant, and my mom was a nurse and my dad was an accountant. So I sympathize with many of the things that you're bringing up, and absolutely everything you talk to us about in terms of how you get health care and your family gets health care. I agree. It's a broken system. We need huge reform here. I've been a big proponent of negotiating for lower prices of prescription drugs ever since I was back in the state legislature. We shouldn't pay the highest prices in the world. It shouldn't be so difficult for your family to get by right here. I agree. No veteran should go without health care. No one in this country should go without health care. But you're wrong to say that undocumented immigrants automatically get health care. The thing that Pam Bondi and other people have been mentioning was something passed by Ronald Reagan. It's been a law for many years, and it says that if any individual comes into a hospital, no matter what, if they're in a serious car accident, if they're having a heart attack, you don't say, let me see your papers, I'm not sure if I can treat you. You treat them, and then the federal government reimburses you. But they don't automatically go on the Medicare system or anything else. You cannot be an undocumented immigrant in this country and collect health care. That's just a lie. The Republicans are using it to try to combat the very valid points that we're making on the Affordable Care Act, premiums, on Medicaid costs, on hospital closures. I have a hospital in Maine, Waterville Hospital, that closed this year. We've had other units closed. It's a huge issue for all of us. Honestly, we're all in this together. We're all saying many of the same things. And to try to say that, we're the ones that are breaking up these systems, we're the ones who are trying to reform it and try to keep it going. And we're desperately worried that by the end of the year, between the big ugly bill and the Republicans' unwillingness to extend these tax credits, we're going to have millions of people in this country without health care coverage, and we're going to go back to a system where hospitals are trying to provide charity care, don't get sufficient Medicaid funding, and they're going broke. Whether you live in the middle of the city or out in a rural area like mine, you're going to have some huge problems to face.